First, the promise.
We will lower your premiums by $2,500 per family per year. We will do it by the end of my first term as President of the United States of America. We're going to work with you to lower your premiums by $2,500 per family per year, and we will not wait 20 years from now to do it or 10 years from now to do it. We will do it by the end of my first term as President.
Hospitals will pay you to see him. That's a ticket. Well, anyway, nice promise, but in reality, pricier premiums, strike close to $2,400 pricier. That is how much the average American family's premium has soared under this president. Don't say I didn't warn you. We actually read the bill here. You know, we're kind of nerdy, but we read the bill. And we weren't Einstein lawyers or Perry Masons, but we could understand enough to know that premiums were going to go up, that companies would prepare in advance of taking on all these extra insured and hike their fees. And we realized that big and small state and local institutions would have to do the same. But enough about me. Back to someone who fully agrees with me, who was saying actually the same thing back then, Steve Moore. Steve, you really didn't have to be Nostradamus to figure out if you were demanding all these insurance companies, by the way, no saints, but if you're going to tell them you have to pick up coverage for all of this, and the money to kick in from younger folks are going to have to have coverage, won't come in until years after this, premiums are going to go up and up a lot, and so they have.
Well, that's exactly right, Neil. And by the way, this is the least shocking news of the week, that these healthcare premiums are up, because
by the
people
way,
like you
we're
and
going to have a new segment here, Steve, but not a Fox Alert.
Exactly.
I don't know what we do, but go ahead.
You know, here's why it didn't work, and here's why, by the way, a lot of the benefits haven't even kicked in yet, so I think these costs are going to go up even higher in the years to come. But look, Obamacare is based on trying to repeal the law of economics. As you just said, if you increase the demand for something by putting more people in the health insurance system, but don't increase the supply, you don't have to be a genius to understand that the cost of these things will go up. And it's interesting, by the way, isn't it, Neil, that the two areas of the economy, the two sectors of the economy that we don't allow competition, we don't allow the price system to work, is in education and healthcare. And those are the two industries where the inflation rate just keeps rising and rising and puts a pinch on American family budgets.
You know, then let's kick in the money coming in part. I'm trying to give the administration its due here. Let's say you get to that point, I think it's 2016, when everyone has to start paying it. Now we're told that 6 million have to pay the penalty because it could be that severe, or that many could either be out of work or they didn't calculate right. Nevertheless, they pay the penalty and or they're picking up insurance. That money coming in, presumably from younger folks in better shape or feeling that they're less of a health risk, mitigate that premium POW. Do you agree with that?
No, I think it makes it worse. I mean, what you're going to get, Neil, is a death spiral in the insurance market where healthier and healthier people are just going to move into the government-sponsored system, and then you're going to have all these unhealthy people with high health care costs in the insurance pool. The insurance costs are going to go up. And by the way, you know where this leads, Neil. You know the end game here, which is that I believe in 5, 6, 7, or 8 years, everybody's going to throw up their hands and say, these greedy insurance companies, they can't keep the costs down. Let's move to a single payer system. I always have believed from the start that was the end game.
Absolutely.
And that Obamacare was simply a step towards it.
You could just see it. And then if people end up having to pay the penalty or whatever, you more or less force that issue. And that ultimately might have been the Trojan horse deal.
That's right. And you talk to a lot of employers. I do, you do. And what they're saying is, you know, they're doing the math. And they're saying, you know what, it's cheaper to get rid of my health care plan that I've had for 15 or 20 years for my workers and put these people into what they call the public option plan. You know, we know it's just so frustrating because that is going to lead to exactly what the American people have said they don't want, which is a government-controlled and government-run system. But there's no other way, you know, to control the costs once you get into that death spiral.
Well, you know, it's just the old adage. I mean, if you expect the government to pick up the tab for everything and you're not going to be charged an extra anything, then you're clueless. You're just
what's the old bumper sticker that so many people have in their car? If you think healthcare is expensive now, wait until the government gives it to you for free. And that's exactly what's happening, right?
That's well put. I didn't see that bumper sticker. All right, Steve,
I'll
thank
you. I'll get you one of those.